So Sonali also asks, I have heard that a full consultation / X-rays are done by some chiropractors before adjustments. Is this a common practice across the field? Well, some chiropractors might not do it, in which case they're not doing a very good job. They're not coming up to the standard of care. Standard of care is that everybody gets a complete examination when they come to your office. Certainly they do in my office. In fact, there's one of the videos here. It's called What You Should Expect on a First Visit from a Chiropractor, where I go into more detail about what that exam should look like. I do have an X-ray machine in my office. I X-ray patients. I don't X-ray everyone. There has to be an indication from their symptoms that they need X-rays. Ideally, yeah, if I did X-rays on everybody, I'd know a lot about their spines, but there's a benefit versus risk ratio you have to look at when you're taking X-rays. The X-rays, I mean, a set of X-rays is not going to cause you harm, but we don't want to just X-ray people. Like the reason, for instance, you don't X-ray a pregnant woman. The idea, or the odds rather, that you're going to cause any kind of problem to the fetus by doing X-rays are very small. But if everybody's doing it, you're going to have more problems from X-rays with fetuses. The same thing with the general population. People wind up over the course of their lifetime getting a certain number of X-rays. Now, there's different levels of exposure that you get. I mean, if you get a few CAT scans, CT scans, then you're going to have a whole lot more X-ray than you get from a set of X-rays you get in a chiropractor's office. So there's a technique I use, which is the Gonstead technique, and Gonstead traditionally X-rayed the entire spine. But this is he practiced from the late 20s into the early 70s. These days, you really don't need to X-ray every single person, their entire spine. So I X-ray the area where there's a problem, along with a thorough exam, getting a history from the patient, learning what the problem is, and doing an appropriate examination so that I know not only what's wrong with them, but how long it's going to take, what the person should expect, so I can give them a reasonable plan of action.